Hi there, Dr. Mistry here, helping you again prepare for your vasectomy. How you are sedated or how you are made comfortable during your vasectomy is a question that a lot of patients have for us. And it does vary from patient to patient, it does vary from doctor to doctor, and probably based upon the rules that are in your state, it may change there as well. So if you want to go completely to sleep, like a general anesthetic, that is possible. Urologists don't like to do that necessarily because it does take a lot longer to put you to sleep and wake you up for a procedure that we can do in the office in oftentimes under 10 minutes. But for those patients that have a lot of anxiety, we will put you to sleep. There are also some states and some cities and some urology practices where the urologist might own a surgery center, and for them, there's better reimbursement, and for them, doing it in the operating room with you asleep may be a better both financial and comfort level type decision. In our office, we offer intravenous sedation. IV sedation has some benefits. Number one is you can be given more or less of it during the procedure, so we can titrate the dose of it a little bit better. IV sedation also allows us to consult you when you're completely sober and then do the procedure with the maximum sedative that we can safely do here in the office. It doesn't cost anything extra when you get that done here in our office because it makes your life easier. It actually makes the life for the surgeon a lot easier too. So we really prefer when people are healthy enough to get the IV sedation. Many offices will offer nitrous oxide, that's laughing gas, like some of you may remember from dentistry. It doesn't really help anesthetize anything, but it does help you not remember, and it does relax you. Oftentimes that'll be provided at a charge anywhere between $100 and $300 I've seen out there in the market. We don't offer nitrous oxide because the IV sedative is just better in our experience. And a lot of times we just don't like to charge patients extra, and that nitrous oxide is pretty expensive for the office. You could just take a Valium. Valium could be relaxing to you. We don't do Valium very often, mainly because, number one, we can't prescribe you the Valium before we see you. We can't give you a controlled substance letter or visiting with you. And so that doesn't become an option. So you have to have the consult and then the procedure on separate days. And for our patients' convenience, we don't do that. We like to have them both on the same day. Another problem with Valium is once you take it, you have a limited time for it to work. So if the surgeon gets delayed or you don't take it soon enough, it may not be effective. And you can't take any more. So if you're not relaxed enough after a single dose, it may not work out for you. So that's one of the reasons we don't do it. But if you're very adamantly not interested in getting an IV sedative and want to just have something to relax you, then we'll do the consultation and the procedure on separate days. And then finally, not doing anything at all. We will certainly use a local anesthetic regardless of the type of systemic anesthetic you decide to use. That local anesthetic usually makes it fairly painless. And if you have a nice low-hanging scrotum, it's not going to be a problem whatsoever. But if you look in the mirror and you have a very tight scrotum, if your testicles tend to really pull up into your abdomen, especially when you get nervous or cold, then having something to relax that muscle, make it easier for us to do the vasectomy, certainly helps things quite a bit. I think our use of an IV sedative has greatly improved our patient satisfaction and can make your experience all the better. Look forward to seeing you in the office.